This presentation is going to focus on different accrediting agencies and the accreditation process, the role of QI as it relates to the accreditation process, faculty, curriculum design, and leadership will be discussed. I will also provide my perspective on how accreditation and QI has impacted my radiography program and my role as program director. Let's begin. Quality improvement in higher education can have an impact on many different components within an institution. Academic quality is the core of quality higher education and prioritizes instruction, student learning, and faculty. Institutional quality is more of a broader scope and prioritizes student enrollment and outcomes, leadership quality, sustainability, equitable student access, and the commitment to the community. Together, both academic and institutional quality improvement initiatives are crucial for ensuring academic success and addressing the evolving needs of healthcare education. They can prevent the fossilization of curriculum and improve educational value by aligning education and practice. Accreditation serves as a measure of quality and sets the foundation of expectations and standards that need to be followed. Regional accreditation is considered the most influential and accredits all degree-granting public institutions and most nonprofit private institutions. There are 6 main regional agencies with the Higher Learning Commission serving the state of Iowa. National accreditation is typically found at institutions that are generally for-profit or offer vocational, career, or technical programs. Credits earned from institutions that are regionally accredited are more widely accepted and easily transferable when compared to nationally accredited institutions. Regional accreditation has more broad-based education standards, where national accreditation standards are more flexible to meet the specific needs of the profession. If an institution is neither regionally nor nationally accredited, federal financial aid is not awarded to their students. Agencies who apply to the U.S. Department of Education for federal recognition will be able to furnish financial aid at their institution through various grants and loans. Accreditation is the process of formal evaluation of an educational program or institution against defined standards for the purposes of quality assurance and continuous enhancement. Throughout this process, the program or institution will complete a self-study to evaluate and demonstrate how they are meeting their accredited standards. After the self-study is completed, the accrediting agency will then conduct an on-site visit so that the reviewers can audit the self-study by examining documents, operations, resources, and holding formal and informal discussions. By adhering to minimum standards, the institution is prioritizing student success, professional development, and embracing the changes that are occurring in the healthcare environment. Accreditation has the potential to strengthen the culture of an organization. Administration, faculty, and students are not the only people who are positively impacted. The healthcare environment and the public are impacted as well. It can improve patient experience of care, improve health of populations, improve work life of healthcare providers, and decrease the cost of healthcare. There is a higher demand for distance education, and the student body is changing dramatically. The recent pandemic has required many institutions to move their face-to-face courses online without proper planning or without keeping the student learning experience as a top priority. With more diverse needs and the continuous advancement of technology, the accrediting agencies and the institutions will need to work together to ensure that they can keep pace with the needs and demands of the students and the healthcare field. My radiography program's accrediting agency has one standard specific to programmatic effectiveness and assessment, where data is used for demonstration of sustained improvement. Along with this data, I also have an assessment plan that evaluates whether the students are meeting the established goals and outcomes set by our accreditor. Certain tools we use to collect and analyze this data include evaluations, exit interviews, surveys, reports from the credentialing organization, and a variety of assignments and assessments. Dr. Brenda Barnes is the program director of the MLS program at Allen College. She has recently utilized a QI initiative to help meet her accreditor standard regarding the certification exam pass rate. Dr. Barnes has incorporated structured studying and synchronous sessions with her students to provide them with the information necessary for success. This QI initiative has proven to be effective as she has seen her certification pass rates increase from approximately 60% to over 80%. Accreditation can set the tone for quality education and faculty development. For faculty, it provides a framework for quality teaching strategies, credibility and accountability, and the enhancement of quality teaching standards. Professional development opportunities can include workshop, courses, and job-embedded learning, such as peer observation and mentoring. All of these opportunities provide an avenue for faculty to be an active participant in instructional and programmatic improvement. These opportunities can have a direct impact on student engagement, motivation, and achievement. By aligning them with accreditation standards, we are creating a consistent and rigorous learning experience for all students. This alignment ensures that instructional methods, materials, and assessments are designed to meet the specific needs of learners and promote their academic growth. Learning opportunities that focus on differentiated instruction, formative assessment, classroom management, and technology integration would be valuable. These opportunities provide faculty with the knowledge and tools to address diverse student needs, engage learners, and foster a positive learning environment and culture. Professional development encourages faculty to engage in self-reflection and self-assessment, allowing them to identify areas for improvement and develop action plans for growth. By doing this, they can be good role models for their students who also need to do the same while progressing through their health science program. Accreditation can improve student learning outcomes by providing a framework for developing, reviewing, and revising the curriculum based on best practices. It's important that the curriculum aligns with current practice and technology that is being used in the healthcare field. With the increased diversity and unique challenges that students bring to healthcare programs, it's important that faculty do not shy away from changing the curricular structure of the program to meet the needs of the student and the accreditor. Referring back to Dr. Barnes, her QI initiative included a curriculum revision that included the extension of a review course to provide more structured studying for the students. Synchronous sessions were also embedded within the program. Dr. Barnes wanted to foster a culture that allowed the key stakeholders to have the information necessary so that they could be confident in their decision on when to schedule and take their exam after graduation. With this curricular change, Dr. Barnes has noted that more students are taking their exam within 6 weeks of graduation, and the pass rate percentage has increased from approximately 60% in 2022 to over 80% in 2024. From experience, curricular revisions are made because a gap is signaled. The principles and standards set by our accrediting bodies can help ensure that programs are acknowledging those gaps and implementing an action plan to improve student success. Accrediting bodies expect institutional leaders to guarantee faculty high levels of autonomy regarding course design and delivery, but accreditors also expect a certain degree of standardization to ensure quality. At Allen College, there are policies and processes in place that provide standardization across programs. For example, all programs include similar content within their course syllabus and use the same template when creating and designing online courses. Our accreditor dictates the content that is delivered within each course, but the college provides flexibility to the faculty to decide how that content is incorporated. Providing faculty with this freedom allows them to determine what teaching methods they wish to employ. This same freedom also poses the risk of teaching strategies being utilized that do not meet the needs of the students. Currently, the standards established by the accreditor provides a baseline of expectations, but they don't provide support in helping the faculty understand what they need to do if those expectations are not being met. Ensuring that the institution can provide that level of support and guidance is essential in ensuring that student outcomes are being met and that all faculty and students feel like they have the tools necessary to be successful. As a program director, I am continually working with my faculty to determine ways in which we can improve our radiography program. I have worked closely with our accreditor by implementing new standards, completing a self-study, and managing an on-site visit. That process solidified that we have a lot of great things implemented within our program, but it also confirmed that our work was not done when our site visitors left campus. Quality improvement is a continuous process, and I am learning just how important it is to continue to improve what we are doing well, along with addressing any challenges that we are presented with. Every year, we review our assessment plan and revise the outcomes and measurement tools to try and locate the gaps within our program. We are also currently in the process of revising the curriculum to help improve our first-time pass rates. Our entire program is not afraid to tackle change head-on, so quality improvement remains at the forefront of our decisions and discussions every academic year. Thank you for listening to this presentation on accreditation and quality improvement.